As protests continue across the nation over the killing of George Floyd, health experts warn that these mass gatherings could lead to an uptick in coronavirus infections.
Joining us to tell us more is Chief Health Editor Dr. Nandi. And bottom line, Dr. Nandi, should we be bracing for a second wave soon?
So, Glenda, according to the U.S. Surgeon General, yes, we can expect new outbreaks as the nationwide protests continue, and for a couple of reasons, right? I mean, first of all, not all the demonstrators are wearing masks or keeping 6 feet apart, and anyone who was unfortunately tear gassed or had pepper spray used on them, that causes coughing, and when you're infected with the virus, the cough can spread, thousands of aerosolized particles containing the virus into the air. Now, the same goes for a person who's shouting or they're chanting. Not only can you spread the virus, it's possible you inhale the virus when you take those deep breaths to raise your voice. People are getting arrested, right? We've seen all the unrest, and those folks are sitting in cars close to each other, and some are spending time in jails. All of these situations give the virus a lot of opportunity to get new hosts and get more infections.
Doc, this conversation, a good reminder that we are experiencing two crises, two generational stories at the same time. Do you think people who have been protesting should be tested for the virus?
So, Brian, yes, absolutely. I do recommend folks who have been at one of these protests get tested, even if you feel good, right? You feel fine, you're not having the symptoms, because the CDC says that up to a third of infected folks are asymptomatic. And I did a story just recently that up to 80% in one study were asymptomatic. So if you do test positive and you have the virus, you can self-quarantine. That helps us to keep the numbers down and not infect other folks.
Dr. Nandi, it's been a critical time where people really want their voice to be heard. We've seen young people voicing themselves in ways we haven't recently. This is a passionate time. So when you want to speak out, do you have to be concerned about, your life out there with the virus? I mean, you can't say stop voicing your concern. What do you do?
Listen, Glenda, I really understand the frustration. I firsthand, I was 12 years old. My dad and I were in Ohio. We nearly lost our lives. A man pulled out a shotgun and almost killed us, told us that we didn't belong here in America, we should go back. And I'll never forget that feeling of helplessness that my dad and I, as a young boy, we were judged solely on the color of our skin. So I understand and I support the efforts of folks who are peacefully out there trying to solve the societal problem of oppression. But I'm also a physician. I want people to be safe and alive. So if you're going to protest, I understand. But here's my advice. Please wear a face mask, wear face shields or glasses to protect your eyes, and try not to shout or chant. If you can, bring a voice message or bring noisemakers. Also, keep your hands safe. Keep your hands clean with hand sanitizer. And please try to social distance as much as you can. Keep yourself 6 feet away from others. Super painful time. I don't have to tell any of you this. It's very, very important also that all of us are treated with fairness and respect. But you have to tell you, the virus, it's not treating everyone the same when it comes to who it kills. It's disproportionately, the COVID-19 is disproportionately affecting communities of color. So please don't let your frustration or anger get in the way of making safe choices when it comes to your health, your loved one's health, and the folks around you who are rallying around. So absolutely, I understand the frustration. There's a need to be able to peacefully demonstrate and show what you need to do, but stay safe out there.
Dr. Nandi, thank you for sharing that. That is powerful. That's hate that should not happen. And unfortunately, many people of color experience that. We're glad you were able to share that with us. Thank you so much, Dr. Nandi, for your advice.
Thank you.
Thanks.